Professor Dawn Freshwater is a woman of firsts. She's the first female Vice-Chancellor of New Zealand's University of Auckland, and prior to that, as Vice-Chancellor of the University of Western Australia, she was the first female chair of the prestigious Australian Group of 8 universities. Complementing the leadership prowess that accompanies Vice-Chancellorship, Professor Freshwater's research and scholarly interests are equally impressive. Dawn has completed significant research in the fields of mental health nursing, mixed method studies, and much more besides. Dawn is a respected scholar and writer, and she is a contributor to the forthcoming Routledge Handbook of Philosophy and Nursing. It's in that capacity that we're talking today. Hello, my name is Martin Lipscomb. I'm talking to Professor Dawn Freshwater. Dawn, thank you for joining me. Please, would you outline the argument put forward in your chapter, Anxiety and Moral Courage, the Path to Authentic Nursing? What is the problem or issue being addressed in this work, and what, if anything, can be done about this issue? What is the path to authentic nursing?
Thank you, Martin. Thanks for the opportunity to speak with you about this today. And actually a really complex question. What is the path to authentic nursing? And we start really by looking at what is authenticity, why does it matter, and why is it important in nursing? And if I unpick that a little bit, I'd start by drawing upon somebody I really worked very closely in understanding many, many years ago as part of my nurse training, and that was Carl Rogers. And understanding the relevance of being genuine, of congruence, and unconditional positive regard, and the way in which those things, when they're combined, lead to a sense of authenticity and the experience actually of authenticity in the nurse-patient relationship. And whilst those theories were not particularly aimed at nursing, they were really in support of caring relationships. One of the things that I think has become more and more complex and actually quite anxiety inducing for nurses, and particularly for nurses who have been working in recent years with what can only be described as really quite significant challenges to moral courage, is the ability to remain congruent with themselves, embodied with their own beliefs and values, and using their own beliefs and values, their own understanding of themselves, and behaving in a genuine way in order to really give and receive in that reciprocity of the nurse-patient relationship what we might understand as care. One of the things I relate it to is perhaps from a philosophical point of view, the ability to act in good faith. And for me, what that really means is being able to have a level of consciousness and an understanding of one's own vulnerability, one's interdependency, one's fear of living, as well as fear of dying. And in all of that, really being present with the patient, the person, the individual, the families that we are working with and living with and attending to as we inhabit our daily practices.
Okay. It is a really interesting chapter. I'd like to ask you some questions. You've just mentioned authenticity. Can you tell me, could you say a little bit more about the authentic self? What does it include and exclude? I find the concept of authenticity sometimes problematic. It can be quite slippery. I know that you talk about authenticity as having emotional and physical components. Could you say a little bit more about those components?
And I agree with you. It's actually quite difficult to get a line of sight on, because authenticity is changing all the time. If we think about Rosemary Parsay's theory of human becoming, if we think about some of those early theorists around nursing, then that whole sense of both being in the process of becoming at the same time as being is some way to understanding why authenticity has a slipperiness to it, because it has to be by necessity, if evolutionary, as we are evolving, as we learn more about ourselves, as I reflect and as I become more conscious and aware of what motivates me, what's driving me, what I'm attending to, where my attention is, what triggers me in terms of responding to various patients, then that's a process of becoming. And so as I become more of who I am, then I have the opportunity to become more authentic. But there is also, the authentic self that's currently in existence. So am I aware of both the physical and body components and the mental conceptual components that are, as I speak right now, what am I actually attending to? Am I engaged with myself subjectively and objectively simultaneously? That takes us into a slightly different place, because what I'm actually saying is I can be in relationship with you right now and experience an interpersonal relationship that's quite subjective. But I can also be observing myself in that relationship with you and noting what are the things that are happening and how are they informing the relationship and how are they enhancing it or distracting from it.
Okay. All right. Thank you. Yeah. Okay. There are some other concepts in your chapter which I think are worth mentioning about. You note that emotional distress is in the literature linked with intimacy. So intimate nurse-patient relationships are for nurses associated with vulnerability to emotional exposure and in that way possible harm. Now this negative correlation will strike many as intuitively plausible. However, since nurses are enjoined to empathize with patients, since nurses are encouraged to create or co-create close working partnerships with patients whenever feasible, is nursing's ambition, that is our ambition to form emotionally close, non-objectifying, helpful relationships with patients, at odds with what's good for nurses? Would you elaborate on this potential tension a little bit more? You do sketch a route through this danger or difficulty in your chapter. This is, I think, in part your path. Nonetheless, could you say a little bit more?
Yeah, I mean, I think, I'd simplify some of what I've been saying already and break that down into an understanding of the difference between empathy and sympathy. Let's not, while that is complex, let's not pretend that's very easy to achieve in relationship. But what I'm really saying, you're right. Empathizing is important. It's a signature of what it means to be engaged in a caring relationship. But that empathic journey that you're talking about does require a degree not only of authenticity, but what I've already said, a degree of reflection, a degree of deliberateness about the engagement, and a degree of awareness of where our boundaries are and where our parameters are. And that, I mean, when we talk about empathy, of course, there is a separation in empathy. There's absolutely no point, as we know the story, if somebody has fallen by the wayside and struggling in a ditch, there's no point in jumping in to get them out if you can't get out yourself. We know that. So the reality is there does have to be a degree of subjectivity involved as well as the ability to be objective. I think that what happens in nursing is, well, first of all, there's a question for me. Do we really work through the understanding and the experience of building empathy and the ability to be able to be both in and out simultaneously of the relationship, the caring relationship? Do we really build that in to nurse education? And is it something that we really support through the lifespan of nursing careers? And we can talk about clinical supervision. We can give all sorts of names to the ways in which we provide that support. But the reality is that it's not necessarily something that even nurses take seriously. We are at times our own worst enemy. I think, I mean, I'd end that statement by saying nurses don't always know what's good for nurses, but that doesn't mean that other people do too. And I think therein lies a dilemma, because when I'm saying we simultaneously both have to be in and out of the relationship, that requires not just, a degree training program at the end of which you're competent. It requires a lifelong learning process about what it means to be human and in relationship to vulnerable others with a vulnerable self.
Okay, that's yeah. Um, who could disagree? Now, as you noted, your argument employs the idea of moral courage. Now, moral courage is, if I understand you correctly, an inner personal resource that enables or is associated with ethically correct behaviour. It's a resource that individuals can draw on. That's an interesting idea. However, since very different behaviours can be linked to different conceptions of correct or good ethical reasoning, or the absence of this reasoning, presumably we cannot work backwards from behaviour to courage in any straightforward sense. Now, does this matter? Barring or excluding extremes of good or bad action, bad behaviour, does it matter that in the absence of agreement on what correct or good ethical reasoning is, we cannot know if actions derive from moral courage, since we cannot assess the or verify the existence or absence of the linkages between action and moral courage? A bit of a windy question, but this linkage, your reference to ethically correct or good reasoning, remains something of a black box. Does this impact the use value of the idea of moral courage?
Well, my straightforward answer to the very last point you just raised is no. I don't. I think, moral
Okay.
courage can stand, but you've actually introduced a whole range of concepts there. I just want to land on the term you used, verify, and to talk about verity and think about the way in which we understand our truths and our truth telling, and how we get to the point of reasoning through that really important dialogic experience of not only speaking our truth, understanding our truth, verifying that, but also working that through in dialogue with other people's truths. And, that has to be, in that process, the edges have to be knocked off our own reasoning, and there has to be some, there might be some elbowing that's going on, but within that space there needs to be some flexibility and our own ability to be influenced by other people's truths and validities. I think, how moral courage is developed is something that, as you say, is a bit of a black box, but I understand it in this way. If we go back to, early works such as Benner's Ways of Knowing, and go really start to work through that whole novice to expert continuum. And I'm really drawing on some, some quite historic concepts here, but I think they still ring true, that verity ringing true in the sense that as we develop our skill sets through practice, there is the opportunity to constantly go back through different ways of knowing and to check in with ourselves through the experience that we're having, through this is both the embodied experience, but it's also the conceptual and tacit ways of knowing, constantly checking backwards and forwards. Are we now responding to this situation using the ethical evidence base that we have built, and all of the exemplars that we already have, can they be brought to bear in this context and then thought about quite differently because of the new context that we're in? And in all of that, also bringing our personal way of knowing, which is back to the authenticity. So what I'm really saying is, I think that moral courage is, actually quite complex, but it's essentially an experiential thing for me, and not something that you necessarily learn through text or through reading philosophy or through conceptual arguments or through moral reasoning, all of those things are important. It's when that gets put into practice and tested out and experimented with, and all of that work that we do internally afterwards, where we're asking ourselves, replaying the conversation, replaying the action, keeping ourselves awake at night, wondering what more could I have done as we go through our ethical decision-making process, and checking in with all of those different ways of knowing to then take a qualitative leap, which actually for me is the sense of moral courage that I'm talking about, which will then bring us to the next decision, the ethical decision that we have to take, which probably won't be very far away.
Okay, I think my meandering question really was, so I have an unnatural interest at the moment in various forms of skepticism, and it's just trying to work out what we can and can't know. But just a comment, your chapter references resilience and the place and importance of resilience. Now, in contrast, it has been suggested replacing the somewhat optimistic and upbeat word resilience with the perhaps more visceral and realistic term endurance could be appropriate. So rather than asking or training nurses to be resilient, we might more accurately require that they endure. Do you have a view here?
Well, let me just first of all go back to your comment about knowing and not knowing. I really feel quite strongly that in the context of AI, emerging technologies, digitization, we really need to make sure that we hold on to not knowing and unknowing, two different things, of course. And that's a whole different conversation, but I really like the way in which you've brought that in, because I think it's actually a really important part of moral courage, unknowing and not knowing, both. Um, do I think endurance is a better way of thinking about, or well, it's a different way of thinking about nursing practice and resilience? I think resilience is very overused. I'm not sure I think it's been monopolized and probably colonized by different groups. Endurance to me, as a past marathon runner, endurance to me has a particular resonance that I think does have some relevance to nurses and nursing practice. Um, there is a part of what we do and who we are that endures. And that's not necessarily a negative thing. I am currently in a university that is 140 years old. It has endured through multiple challenges, wars, all sorts of things. And, there are many benefits to that endurance. So I think I think resilience often has this sort of, it's quite difficult connotation in terms of negativity, but or the somehow that you fail if you're not resilient. But if we're really drawing on self-determination theories, and some of what I have just referred to in this interview is around self-determination theories, then I think endurance is actually a better concept.
Okay. Dawn, really interesting. Thank you for taking time to talk to me. And for those who'd like to know more about Professor Freshwater's work, links will be provided in the accompanying notes. Dawn, that was really interesting. Thank you. Thank you for talking.
Thank you.